For this lecture for MLT 110, we'll be covering lecture material for Unit 1. Lesson 1 will cover information on the introduction to the clinical laboratory itself. There's two types of clinical laboratories. The two main types are either hospital laboratories or non-hospital laboratories. Hospital laboratories can be private hospitals, for-profit, or university teaching hospitals, military, even the veterans or VA hospitals. Services usually provided depend on the size of the hospital. In your non-hospital labs, these are usually your doctor's offices. These are also known as your POLs. There's a wider availability of the rapid test kits and small analyzers that broaden the scope of testing that's done at your doctor's offices or your physician's offices. Wave testing is usually performed at doctor's offices, and we'll talk a little bit more about wave testing, but wave testing is usually simple tests that have a less likely or less room for error. Reference labs are another non-hospital labs. These are usually privately owned. These can be regional labs that do high volume testing. They do a wide variety of more complex testing. Examples of that might be LabCorp. Their main headquarters is in Burlington, North Carolina. You might have heard of Quest Diagnostics as another one. We also have government labs. We have government labs at the federal level and at the state level. Our North Carolina State Lab is located in Raleigh, and the federal CDC is located in Atlanta, Georgia. As a clinical laboratory, there's certain regulations that we have to follow, and these are called CLIA or Clear Certificate categories. All clinical laboratories have to follow minimum performance standards, and there was an act called the CLIA or Clinical Laboratory Improvement Act of 1988, and sometimes you'll hear it referred to as CLIA 88. And again, it just specifies minimum performance standards for all clinical laboratories. So these are the guidelines that all labs have to fall within to operate. So all clinical labs performing human testing need to have a clear certificate, and there's 5 different categories for clear certificates depending on the complexity of the testing being done at the facility. The first clear category is the certificate of waiver. These would be those simple tests that I mentioned a little bit earlier. These would be the most common tests performed at your doctor's offices. These are simple tests that don't have a high risk of error, and these could be tests that you could even perform at home. Examples of these would be like the glucose test, pregnancy test, and even your at-home COVID test. Number 2 on the list would be the certificate of physician-performed microscopy. This would allow the physician at the office to actually perform things like a urinalysis, looking under the microscope, or looking at wet mounts for vaginal samples. Again, it's the physician looking under the microscope. The third type of CLIA certification is the registration certificate, and this is kind of like a temporary permit until official inspection can be conducted. So labs can conduct moderate and high complexity testing or both while or before the survey has been completed to make sure that they're in compliance. Again, it's more like a temporary permit. Next on the list is the Certificate of Compliance. This is issued to the lab after they have been operating under the Certificate of Registration and the official inspection has taken place and the lab has been found to be compliant. And then the next thing that is issued is the actual Certificate of Compliance. The last CLIA category is a Certificate of Accreditation. This is issued to the lab that has been accredited by the CMS, which is the Center of Medicare and Medicaid Services. This is an approved accreditation agency and allows for moderate and complex testing. This is example of a clear certificate. So when you go into a laboratory next time, look for their clear certificate. It will tell you what level or category their clear certificate is. This one example happens to be a certificate of registration. It'll give you their CLIA ID number on the certificate. It'll give you the date that it's effective, the expiration date. Most labs are very proud of their CLIA certificates because they worked very hard to be able to pass and earn their CLIA certificates. Within a clinical laboratory, there's several different departments. Now, some hospitals may not have all these departments, and some doctor's offices might not have all these departments, but they may have some of them. At a larger hospital, you may see all these departments, just depending. But first off, we're going to start off with hematology. Hematology is the study of the cellular components of the blood. So you're going to be looking mainly at your white cells and your red cells when you're in the hematology department. The next department is coagulation, and sometimes this is lumped in with hematology, but these are going to be looking at tests that deal with blood clotting. A lot of times you're going to be dealing with specimens with patients that are on blood thinners. Most hospitals are going to have a urinalysis department. The urinalysis department, you're going to be looking at the physical, the chemical, and the microscopic properties of urine. One of the first things you do when you go to the doctor's office or go to the hospital, they're going to get a urine sample and they're going to look at it and try to determine if there's anything going on with the patient. Next up is the clinical chemistry department. This is the department where we can test whole blood, plasma, serum, body fluids, even urine, and we're looking at the different chemical analytes within all those different body fluids to try to determine what's wrong with the patient. Some of the common tests that we do in the clinical chemistry department is blood glucose, cholesterol panels, liver enzyme panels, cardiac panels, electrolyte panels, drug screens. There's a whole array of things that can be done in clinical chemistry. Next is immunology. This department is usually a smaller department within the clinical laboratory, so sometimes it gets lumped in with one of the other departments within the laboratory setting. But usually what happens in immunology is you're performing tests based on antibody-antigen reactions within the body. So normal tests that are in immunology are the mono test, the HIV test, sometimes influenza, hepatitis, some of your other STD tests. Just infectious diseases overall is a lot of times lumped into your immunology department. Next on our list is blood banking. We receive samples into blood banking to determine a patient's blood type. Also, we do cross matches in blood bank to determine whether a unit of blood is safe to give a patient if a patient needs blood. A blood bank is very important, especially to a hospital that has an ER, because if there has been a traumatic event and a person is bleeding out, it's very important that the lab tech gets the blood to the ER that the patient needs. Next up is the microbiology, virology, mycology, and parasitology. And a lot of times these are all lumped in together, but microbiology is dealing with bacteria. Virology would be dealing with your viruses. Mycology would be dealing with the fungus. And then parasitology would be dealing with parasites. Molecular diagnostics is up next. This would be the area where you're looking at RNA or DNA to diagnose samples. Finally, the last department would be support services. This would be all the things that's kind of going on behind the scenes of the lab. This would be making sure that samples get registered correctly, that all patient information is correct, that everything is going and being processed correctly with the sample, that all patient sample results are getting reported correctly. All the information that's going out to doctor's offices are correct and getting put out in a timely manner. So everything that is supportive behind the actual lab result being ran would be support services. Most laboratories have an LIS system now. This is a laboratory information system, and it can be integrated into the hospital's computer system, or sometimes it's the exact same computer system. They all work on the same one. This helps reduce errors, improves efficiency, and it helps with specimen identification and tracking. And also, it's part of the patient ID bracelets. Everything's barcoded, so that helps with patient ID. There's several advantages to the LIS system in a laboratory. Of course, there's the elimination of charting errors because we don't have handwritten charts anymore, and of course that also improves efficiency. There's also automatic checks that's done by the LIS system, so it flags things for the lab tech to check and make sure that it's okay before those results are reported out. So, for example, maybe a patient's results were normal this morning, but then this afternoon the same patient's results were ran and it was way different. So it flags it, the LIS system flags it for the lab tech to check behind and make sure that that result is a good result and that it can be released. So that's a way to catch errors a lot of times. Those are called delta checks. Also, everybody has their own sign-in, so it prevents unauthorized testing or unauthorized reporting, and everything's tracked inside the LIS system, so everybody knows who is signed in, who's done what, and it's just a good system to make sure everything is accounted for. Quality assessment is very important to the clinical laboratory because we want to put out quality results for our patients. CLIA 88 was actually expanded to include quality assessment. All laboratories must now have comprehensive programs to evaluate, monitor, and improve overall laboratory performance. In each department, they must follow quality insurance in all their daily operations. Usually, one person in the laboratory is responsible for the quality assessment program and make sure that the documentation is done for the entire laboratory. Each aspect of testing is included under the umbrella of quality assurance, whether it's from ordering the test, completing the test, or reporting the results out from the test. All of that falls under the umbrella of quality insurance. Proficiency testing is required by CLIA if you do any moderate or complex testing in the laboratory. It's part of your QA program. This is where you're sent unknown samples or blind samples that you have to test and send the results back in to the proficiency testing agency. And this is just to ensure that you are doing the test the correct way and that you're producing quality results. Accreditation is a voluntary process that laboratories go through to gain more recognition, and it's just saying that they have met or exceeded standards for a laboratory. There are several different accrediting agencies that you can go through to get accreditation. The Joint Commission is an agency that accredits the hospital, the whole hospital itself. The College of American Pathologists is who usually accredits a hospital laboratory. The American Association for Blood Banks would, of course, just do blood banks. And the Commission on Office Laboratory Accreditation, or COLA, would be focused more on doctor's office labs.